Alzheimer's Level 1 Training. Level 1 Training presented by Cheryl Stockstill, my ALF consultant. Learning Objectives. Level 1, 4-hour course. Upon completion of this 4-hour course, you should be able to demonstrate an understanding of Alzheimer's disease and related disorders, recognize characteristics of Alzheimer's disease, understand effective techniques to communicate with residents with Alzheimer's disease, identify family issues relating to Alzheimer's disease and caregiving, describe an appropriate resident environment for Alzheimer's residents, understand relevant ethical issues as they apply to people with Alzheimer's disease. Learning Objectives continued. Identify techniques to managing challenging behaviors. Describe effective ways to offer assistance with activities of daily living. Describe therapeutic activities. Understand stress management techniques. Understand current medical information in providing care for people with Alzheimer's disease. Pre-test Level 1 Training. True or false questions to think about. Alzheimer's disease affects all seniors. B12 injections can cure Alzheimer's disease. Alzheimer's disease is curable. It's best to redirect a person with Alzheimer's if they are agitated. All Alzheimer's residents have the same behaviors. You should do most of your activities at night. Pre-test Level 1 training continued. More true or false questions to read over. Being a caregiver to Alzheimer's residents is stressful. There are different stages of Alzheimer's disease. Attending a caregiver support group meeting can be helpful. People with Alzheimer's can't make any decisions for themselves. All Alzheimer's residents are incontinent. What is dementia? Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Memory loss is an example. Alzheimer's disease is the most common type of dementia. Dementia is not a specific disease. It's an overall term that describes a group of symptoms associated with decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday tasks and activities. Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia, which often occurs after a stroke, is the second most common dementia type, but there are many other conditions that can cause symptoms of dementia, including some that are reversible, such as a vitamin deficiency. Dementia is often incorrectly referred to as senile dementia, which reflects the formerly widespread but incorrect belief that serious mental decline is a normal part of aging. While symptoms of dementia can vary greatly, at least 2 of the following core mental functions must be significantly impaired to be considered dementia: memory, communication and language, ability to focus and pay attention, reasoning and judgment, visual perception. People with dementia have had many problems with short-term memory, keeping track of a purse or wallet, paying bills, planning and preparing meals, remembering appointments, or traveling out of the neighborhood. Many dementias are progressive, meaning symptoms start out slowly and gradually get worse. What is Alzheimer's disease? It is a type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with daily tasks. Alzheimer's is the most common form of dementia. Fact: Alzheimer's disease accounts for 50 to 80% of all dementia cases. Alzheimer's disease is not a normal part of aging. Dementia is caused by damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, thinking, behavior, and feelings can be affected. The brain has many distinct regions, each of which is responsible for different functions. For example, memory, judgment, and movement. When cells in a particular region are damaged, that region cannot carry out its functions normally. Different types of dementia are associated with particular types of brain cell damage in particular regions of the brain. For example, in Alzheimer's disease, high levels of certain proteins inside and outside brain cells make it hard for brain cells to stay healthy and communicate with each other. The brain region called the hippocampus is the center of learning and memory in the brain, and the brain cells in this region are often the first to be damaged. This is why memory loss is often one of the earliest signs. While most changes in the brains can cause dementia, and they are permanent and worsen over time, thinking and memory problems caused by the following conditions may improve when the condition is treated or addressed: depression, medication side effects, excess use of alcohol, thyroid problems, or vitamin deficiencies. Fact: the majority of people with Alzheimer's disease are over 65 years old. Alzheimer's worsens over time. Alzheimer's is a progressive disease where it worsens over time. It comes in stages. Early stage. Memory loss is mild. The symptoms of Alzheimer's disease worsens over time, although the rate at which the disease progresses varies. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years depending on other factors. Changes in the brain related to Alzheimer's begins years before any sign of the disease. This time period, which can last for years, is referring to as the preclinical Alzheimer's disease. The stages will provide an overall idea of how abilities can change once symptoms appear. The early stages, a person may function independently. He or she may still drive, work, or be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or location of everyday objects. Friends, families, or other close to the individual begin to notice difficulties. During a detailed medical interview, doctors may be able to detect problems in memory or concentration. Common difficulties include problems coming up with the right word or name, trouble remembering names when introduced to new people, challenges performing tasks in social or work settings, forgetting material that one just read, losing or misplacing a valuable object, increasing trouble with planning or organizing. During the moderate stage, the dementia symptoms are more pronounced. A person may have greater difficulty performing tasks such as paying bills, but they still may remember significant details about their life. You may notice the person getting confused with words, getting frustrated or angry, or acting in unexpected ways such as refusing to bathe. Damage to nerve cells in the brain can make it difficult to express thoughts and perform routine tasks. At this point, symptoms will be noticeable to others and may include forgetfulness of events about one's own personal history, feeling moody or withdrawn, especially in social or mental challenging situations, being unable to recall their own address, telephone number, confusion about where they are or what day it is, the need to help choosing proper clothing for the season or occasion, trouble controlling bladder and bowels in some individuals, change in sleep patterns such as sleeping during the day and becoming restless at night, an increased risk of wandering and becoming lost, personality and behavior changes including delusions, compulsive, repetitive behavior. Late stage. Individuals lose the ability to carry on a conversation and respond to their environment. In the final stage of this disease, dementia symptoms are severe. Individuals lose the ability to respond to their environment, to carry on a conversation, and eventually to control movement. They may still say words or phrases, but communicating pain becomes difficulty. As memory and cognitive skills continue to worsen, significant personality changes may take place, and individuals may need extensive help with daily activities. At this stage, individuals may need round-the-clock assistance with daily activities and personal care, lose awareness of recent experiences as well as their surroundings, experience physical changes in abilities, including ability to walk, sit, and eventually swallow, having increased difficulty communicating. They may become vulnerable to infections, especially pneumonia. The late stage of Alzheimer's disease may last from several weeks to several years. As the disease progresses, intensive around-the-clock care is usually required. As the disease advances, the need of the person with Alzheimer's will change and deepen. A person will usually have difficulty eating and swallowing, need assistance walking, and they may become unable to walk. They may need full-time help with personal care. During the late stages, your role as a caregiver is to focus on preserving quality of life and dignity. Although the resident may typically lose the ability to walk and express needs, research tells us that some core of the person's self may remain. This means you may be able to continue connecting throughout the late stages of the disease. At this point in the disease, the world is primarily experienced through senses. You can express your caring through touch, sight, sound, taste, and smell. For example, try to play his or her favorite music. Read portions of books that have meaning for the person. Look at old photographs together. Prepare their favorite food. Rub lotion of their favorite scent into the skin. Brush in the person's hair. Sit outside together on a nice day. Since care needs are intensive during this late stage, they may exceed what you can provide. You may need to ask for additional assistance. Fact: Alzheimer's is the 6th leading cause of death in the United States. Fact: a person with the disease can live between 4 to 20 years after being diagnosed, depending on their other medical conditions. Fact: Alzheimer's has no cure. Quick facts: 5.4 million Americans are living with Alzheimer's disease. 1 in 8 older Americans have Alzheimer's disease. Alzheimer's disease is the 6th leading cause of death in this country. There is no cure for this disease. Symptoms of Alzheimer's. The most common early symptom of Alzheimer's is difficulty remembering newly learned information. Alzheimer's in the brain. Microscopic changes in the brain begin long before the first signs of memory loss. The brain has 100 billion nerve cells, which are called neurons. Each nerve cell connects with many others to form communication networks. Groups of nerve cells have special jobs. Some are involved in thinking, learning, and remembering. Others help us to hear, see, and smell. They do their work. Brain cells operate like tiny factories. They receive supplies, generate energy, construct equipment, and get rid of waste. Cells also process and store information and communicate with other cells. Keeping everything running requires coordination as well as large amounts of fuel and oxygen. Scientists believe Alzheimer's disease prevents parts of cells' factory from running well. They are not sure where the trouble starts, but just like a real factory, backups and breakdowns in one system cause problems in other areas. As damage spreads, cells lose their ability to do their jobs and eventually die, causing irreversible changes in the brain. Your brain is your most powerful organ, yet weighs only 3 pounds. It has a texture similar to firm jelly. Your brain is nourished by one of your body's richest networks of blood vessels. With each heartbeat, arteries carry about 20 to 25% of your blood to your brain, where billions of cells use about 20% of the oxygen and fuel your blood carries. When you are thinking hard, your brain may use up to 50% of the fuel and oxygen. The whole vessel network includes veins and capillaries in addition to arteries. Your brain's wrinkled surface is a specialized outer layer of the cerebrum called the cortex. Scientists have mapped the cortex by identifying areas strongly linked to certain functions. Specific regions of the cortex. Interpret sensations from your body and sights, sounds, and smells from the outside world. It generates thoughts, solves problems, and makes plans. It forms and stores memories. It controls voluntary movement. Left brain, right brain. Alzheimer's disease kills neurons. Cell signaling. Signals that form memories and thoughts move through nerve cells, called an electrical charge. Alzheimer's disease disrupts both the way electrical charges travel within cells and the activity of neurotransmitters. Alzheimer's changes the whole brain. Alzheimer's disease leads to nerve cell death and tissue loss throughout the brain. Over time, the brain shrinks dramatically, affecting nearly all its functions. Fact: Alzheimer's creates massive cell loss. In the Alzheimer's brain, the cortex shrivels up, the shrinkage occurs in the hippocampus, ventricles grow larger. Scientists are not absolutely sure what causes cell death and tissue loss in the Alzheimer's brain, but plaques and tangles are prime suspects. Plaques: abnormal clusters of protein fragments that build up between nerves. Tangles: dead and dying nerve cells. How the brain works. Neurons are the brain's wiring. The brain has billions of neurons, each with an axon and many dendrites. To stay healthy, neurons must communicate with each other, carry out metabolism, and repair themselves. Alzheimer's disease disrupts all three of these jobs. How Alzheimer's affects the brain. Initially, it presents short-term memory loss and mild confusion, but eventually impacts multiple functional areas of the brain and impairs communication throughout the nervous system. As the disease spreads, more and more neuronal functions become increasingly impaired. Neurofibrillary tangles further impair and destroy neuron functioning. Amyloid plaque deposition atrophies and destroys brain tissue, impairing functional abilities that are controlled in the area of the brain where the plaque is concentrated. Memory loss. Normal aging, mild forgetfulness, slowing down of collection and storing information. You can still provide self-care. Thinking and reasoning remains clear as well as orientation to time and place. Memory joggers help. Alzheimer's memory loss starts with mild forgetfulness and progresses to dementia, slowing down of collection and storing of information. Memory jogs don't help. Thinking and reasoning work less. ADRD. They may forget a visit with a loved one the day before, becoming lost or confused trying to get home from a familiar place. Insist events occurred when they did not. Other neurological diseases or conditions that cause irreversible dementia. Vascular dementia. Vascular dementia is a decline in thinking skills caused by conditions that block or reduce the flow of blood to the brain, depriving brain cells of vital oxygen and nutrients. Dementia. It's an impairment in thinking and reasoning that eventually affects many people with Parkinson's disease. Parkinson's disease dementia. Parkinson's disease dementia is different from a similar disorder known as dementia with Lewy bodies. Lewy bodies is characterized by fluctuations in alertness and attention, recurrent visual hallucinations, and Parkinsonian motor symptoms like rigidity and the loss of spontaneous movement. In this disorder, the cognitive problems such as hallucinations tend to occur much earlier in the course of the disease and often precede the difficulties with walking and motor control. Parkinson's disease dementia. People with Parkinson's disease dementia have microscopic protein deposits in their brain called the alpha-synuclein. Those deposits are called Lewy bodies. Parkinson's disease dementia, an impairment in thinking and reasoning that eventually affects many people with Parkinson's disease. Lewy body disease. Lewy body disease is a type of progressive dementia that leads to a decline in thinking, reasoning, and independent function because of abnormal microscopic deposits that damage brain cells over time. Huntington disease. Huntington disease is a progressive brain disorder caused by a defective gene. This disease causes the changes in the central area of the brain, which affect movement, mood, and thinking skills. Creutzfeldt-Jakob disease. It is the most common human form of a group of rare, fatal brain disorders known as prion diseases. Frontotemporal dementia. This is a group of disorders caused by progressive cell degeneration in the brain's frontal lobes, that is the area behind your forehead, or its temporal lobes, which are the regions behind your ears. Korsakoff syndrome. This is most commonly caused by alcohol misuse, but certain other conditions also cause the syndrome. Traumatic brain injury. This may affect a person's cognitive abilities, including learning and thinking skills. Scientists have identified factors that increase the risk of Alzheimer's. The most important risk factors are age, family history, and hereditary. It can't be changed, but emerging evidence suggests that there may be other factors we can influence. Conditions that can mimic symptoms of ADRD. Medications. Side effects may be confusion, memory loss, and disorientation. Delirium causes speech problems, changes in thinking, and disorientation. Depression causes thinking problems or can't stay on task. Hypothyroid can cause memory loss, irritability, and depression. Vitamin deficiencies can cause memory loss or irritability. How is Alzheimer's disease diagnosed? Alzheimer's is diagnosed through a complete medical assessment. Fact: there is no single test used to determine if an individual has ADRD. Diagnosing Alzheimer's requires careful medical evaluation including a complete medical evaluation, mental status testing, physical and neurological exam, blood and brain test, evaluation by a memory clinic or specialist, medication interaction evaluation, screening for depression, treatment. There is no known cure at this time. There is no known prevention. Treatment with medication. Acetylcholinesterase inhibitors include Aricept, Exelon patch, Razidine. How can they help? They can slow the buildup of beta-amyloid plaques, stabilize symptoms in early stage and mid-stage Alzheimer's. They may delay the need for assistance with daily activities. Acetylcholinesterase inhibitors lose their efficacy in the late stage. These medications are expensive. Pitfalls of medications for treatment of ADRD. Response not consistent from person to person. Side effects. Expensive. You may need to try several medications before you find one that works for you. Medications. Namenda, approved in 2003 for mid to late stage Alzheimer's patients, used in combination with acetylcholinesterase inhibitors or alone. They affect neuron receptors to prolong functioning. They may stabilize behaviors. Causes of ADRD. Age. After age 65, the risk of Alzheimer's doubles every 5 years. After age 85, the risk reaches nearly 50%. Family history. The risk increases if more than one family member has the illness. When disease tends to run in the families, either hereditary or genetics or environmental factors, or both may play a role. Genetics. Risk genes increase the likelihood of developing a disease, but do not guarantee it will happen. Current research. Currently, there are 5 FDA-approved Alzheimer's drugs that treat the symptoms of Alzheimer's, temporarily helping memory and thinking problems in about half of the people who take them. But these medications do not treat the underlying causes of Alzheimer's. Statin drugs used to lower blood cholesterol are under study for possible secondary benefits for reducing risk for AD. Folic acid, vitamin B6, and B12 therapy appear to lower homocysteine level, which has been associated with AD. Antihypertensives decrease damage to blood vessels in the brain to reduce Alzheimer's disease risk. Clinical trials. Clinical trials are the engine that power medical progress. Through clinical trials, researchers test new ways to detect, treat, and prevent Alzheimer's disease and related dementias. Without clinical trials, there can be no new treatments or cures. Many drugs are being studied for additional therapeutic application.